So I assume you're asking about like chemotherapy ineligible patients, so all the patients who receive HMA-1 therapies, but then they become eligible for transplant even though they are not eligible for chemotherapy, right? So I think there's a lot, we know that if these patients actually can go for the transplant, the outcomes are way, way better. So the reported data have shown the survival in the range of 60 to 70% for patients who got induced with HMA-1 and were able to proceed towards allogeneic stem cell transplantation. So I think that's one part of the story. But we're certainly trying to get the depth of remission, like improved depth of remission. There are not so many drugs right now that are available to do so. For example, there's effort to do it in the FLT3 mutated AML patients where we do what we call triplet therapy, combining the FLT3 inhibitor, Gilteritinib, and Azacitidine. The study is still ongoing. There was a pilot study published from MD Anderson group that showed high responses and good durability of responses and high MRD negative rates. So the phase 2 study is ongoing. So we'll see if that really kind of pans out. And there's also always like a safety consideration whether the therapy is actually tolerated well. But I think in the future, what hopefully we will see that we're going to add specific agent to the doublet, right? There's another effort to aid, for example, IDH1 or 2 inhibitors, because another like finding from our genomic study is that these mutations are not eradicated with Venetoclax, so they persist. So, and there are also data that adding the IDH1 or 2 inhibitors increase the depth of response and they are not toxic. So that one is also like ongoing right now. It's a non-randomized study. In the future, hopefully the menin inhibitors will come through for NPM1 and MLL rearranged leukemias. And there's a lot of like new things that are being tried in that subset, but I'm hoping that within like few years we will see that some of this will be successful, and we'll be using those in the these patients to improve their cure rates.